This is Jerry Hesch with the Hesch Institute in Henderson, Nevada, and this is our client who had a restriction of pelvic side glide, which we attempted to improve, and we did improve it somewhat, but I made the comment that I believe that perhaps because of your transitional vertebrae at L5S1, perhaps that's the reason why I didn't feel like we could fully restore that movement. But here's a way of adding numbers to the amount of force. I'm going to push through this bathroom scale. It's a heavy-duty one. It's actually a Pelvic scale they use in the shipping industry. So I'm going to push, and then I have this firm padded device between. So I'm going to push. I want you to tell me when your pelvis stops moving.
There.
So I'm pushing you with 30 pounds of force. 30, 32, and I'm going to do a spring on it. Okay? And I'm watching the scale, and it goes as high as 60, perhaps 65. It moves so quickly. You know, it's between 60 and 70. Okay? So when I push you, I feel a stop right there. And when I hold steady, that's 30 pounds. Okay? So we're going to come and do the same thing on the right. And you've been doing the exercises that we showed you for a couple of weeks now. And today you came and I tested you a short while ago. And I pushed with 30 here, and I feel like I hit against a restriction. And now I'm pushing 40, I'm pushing 50, I'm pushing 60, and it's just not going at all. I'm seeing 60, and I just don't perceive any additional movement. Do you?
No, you're moving me on the table, where on the other side I could feel the bones and joints moving.
Interesting, interesting. Yeah, and if I do it without this device, it looks. I push here, and you can see the pelvis moves in that primary mode is side glide. This isn't a research clinic. You know, there are certain constraints I can't control, but without a doubt, the primary movement is left to right pelvic side glide. It's a movement that involves pelvis, hip, spine. And then I add an additional force, and I feel and I see a give. Do you?
I feel it.
Okay. And now I let go, and there's that final recoil. So on this side, it has such an early stop, and I am pushing with an awful lot of force. It feels very similar to that 60-pound of force, and it's just not moving. And so I believe that you're not going to gain that movement, but I'm pleased that we gained a little bit of play there. And can you tell us how you're doing with respect to running? When you came, you felt like you had a concrete...
I felt like my right leg was like landing on hard concrete, no give or spring, where my left leg did have spring. Now I ran on Sunday, and a totally different feel. Just I had a very close to similar feel on both sides.
Meaning?
Meaning that I felt like I had gained some of the spring back in the left side. I felt like I was landing on a leg as it should be.
So you feel like the benefit from the first visit has lasted?
Oh, I definitely do. I think it's extremely important. You know, one of the great things that I found is that you not only improve me immediately when I come, but you give me exercises, and it maintains or improves from there. And so again, when I went running on Sunday, the reason I went running, and I hadn't run for a while, was because it was feeling very, very good. I had stiffness afterwards from not having run for a while, but now this is 2 days later, and again I'm headed right back to where I was, with both feeling pretty good again.
So let's go out in the garage. I'm excited about that device. I have a doctor's appointment in a half hour, so I want to at least capture on film that that device for making a crude attempt at measuring active side glide. So I'll stop filming here and we'll start again.